If you're a man over 60, there's something happening inside your body right now that you probably can't feel, but it could be slowly ruining your sleep, messing with your bladder, and even putting you at risk for cancer. And the worst part? You might be causing it yourself every single day without even knowing it. I'm talking about your prostate. That small gland sitting quietly below your bladder is not so quiet anymore. It's growing, inflamed, under pressure. And it's not just aging. It's the things you do every day, like not drinking enough water, sitting too long, or even skipping your checkups. I'm not saying this to scare you. I'm saying it because I've seen what happens when men ignore the early signs, getting up 5 times a night to pee, that constant feeling like your bladder's still full, or worse, finding out too late that something more dangerous is going on. Today, I'm going to show you the 10 daily habits that could be silently enlarging your prostate. They're simple. They're sneaky. And once you understand them, you'll have the power to stop this before it gets worse. Because trust me, once your prostate starts acting up, everything changes. So let's get into it. Habit number 1. Most men don't even realize they're doing this wrong. And it all starts with water. Let's talk about something so simple, so basic, that most people don't think twice about it: water. Not drinking enough of it might seem like no big deal. After all, maybe you're not that thirsty, or you don't want to run to the bathroom all the time. But here's what I wish more older men knew: dehydration is one of the quietest enemies of your prostate. You see, when you don't drink enough water, your urine becomes more concentrated. That means it's darker, stronger smelling, and way more irritating to your bladder. And guess what's right next to your bladder? That's right, your prostate. So every time your bladder gets agitated by concentrated urine, your prostate feels that stress too. Over time, this irritation can lead to inflammation. And when the prostate gets inflamed, it swells. That swelling presses against your urethra, the tiny tube that carries urine out of your body. That's when you start feeling the annoying symptoms: weak strain, urgency, dribbling, or the feeling that you can never fully empty your bladder. And here's what's really frustrating: a lot of men think this is just part of getting older. They brush it off. But the truth is, something as simple as drinking more water could relieve a lot of that pressure. So how much should you drink? The general advice is about 6 to 8 cups a day, but if you're active or it's hot outside, you'll need more. And no, coffee doesn't count. Neither does soda. Just plain water. Try sipping it slowly throughout the day. Don't chug it all at once. You want to stay gently hydrated, not overwhelmed. I had one patient, let's call him Mr. Franklin. He was 68, former truck driver, and he hated stopping for restroom breaks, so he trained himself to drink less. Over the years, his nighttime bathroom trips got worse, his sleep quality dropped, and his prostate kept swelling. Once he finally committed to hydrating properly, things started to change. Fewer trips to the bathroom. Better sleep. Less pressure. It wasn't magic, it was just water. Something we all take for granted. So if you've been ignoring that thirst signal, thinking it's no big deal, think again. Your prostate is counting on it. Now let's move on to something just as sneaky: the amount of time you spend sitting each day. We've all done it: hours in front of the TV, slouched at the kitchen table, or scrolling through our phones in a cozy chair. Sitting is comfortable, right? But the human body wasn't designed to sit for 10 hours a day, especially not without moving. When you sit for too long, especially if you're not shifting positions, something dangerous happens down in your pelvic region. Blood flow slows down. Your muscles stiffen. Your circulation weakens. And all of that creates the perfect storm for inflammation around the prostate. Now, remember, your prostate doesn't have much room to begin with. It's nestled between your bladder and your rectum, and when circulation gets poor down there, waste builds up. That invites inflammation. Over time, this lack of movement creates pressure, constant pressure, on the prostate. And just like any other part of the body under pressure, it swells. And it's not just about the prostate. Poor circulation increases your risk of varicose veins, lower back pain, erectile dysfunction, and more. But for men over 60, that silent swelling in the prostate often shows up first. If you spend most of your day sitting, watching TV, reading, or even working on hobbies, it's time to make some small changes. Stand up every 30 to 60 minutes. Walk around the house. Stretch your legs. Even 5 minutes of light movement can restart circulation and relieve that pelvic pressure. There was this one gentleman, I remember him well, retired librarian, sharp as a tack. But he sat for hours each day cataloging books at home. His prostate symptoms got worse every year until we introduced a walking routine. Nothing fancy. Just 3 10-minute walks each day. After 2 months, he said it felt like someone had turned down the pressure inside. That's what better blood flow does. So if your body's been feeling heavy or stiff, and your prostate symptoms are creeping in, it might not be your age. It might just be how long you've been sitting. And speaking of habits that quietly irritate your prostate, let's talk about caffeine next. Because your morning cup of coffee? It might not be as harmless as you think. Let's talk about your morning routine. Or maybe your mid-afternoon pick-me-up. That cup of coffee, or maybe even 2. Now look, I'm not here to tell you coffee is the enemy. In moderation, it's fine for many people. But here's the deal, too much caffeine can seriously irritate your bladder and your prostate. Caffeine is a diuretic. That means it makes your body produce more urine. More urgency. More trips to the bathroom. And for a healthy young person, that's just an inconvenience. But for someone with a sensitive or enlarged prostate, that extra pressure adds fuel to the fire. Caffeine doesn't just increase urine output, it also stimulates the bladder muscle, making you feel like you have to pee even when your bladder isn't full. So imagine your bladder being poked and prodded all day long by both caffeine and an already enlarged prostate. That's a recipe for discomfort. One of my patients, Henry, he's a retired math teacher, loved his coffee. He drank 2 big mugs in the morning and sipped iced tea all afternoon. But by the evening, he was constantly running to the bathroom, frustrated and exhausted. Once we cut back to 1 cup of coffee a day and replaced his tea with water or herbal drinks, the change was almost immediate. Less urgency. Less frequency. More peace. So if you're having prostate problems, don't just look at how much liquid you're drinking, look at what's in that liquid. Switching out some of that caffeine might be one of the easiest fixes you'll ever make. And while we're on the subject of irritants, let's tackle a spicy topic, literally. Now don't get me wrong, food is joy. I know a little heat makes a meal more exciting, and those ready-to-eat meals in the freezer? Super convenient. But here's what they're also doing, quietly and consistently, triggering inflammation in your body. And your prostate doesn't like that one bit. Spicy foods, especially those loaded with chili powder or hot sauces, can irritate the bladder lining. That irritation radiates down to the prostate, especially if it's already inflamed or enlarged. You might not notice it immediately, but over time, it adds up. More urgency, more discomfort, more swelling. Then there's processed foods, those boxed dinners, frozen snacks, canned soups. Many of them are packed with preservatives, sodium, and artificial ingredients that throw your hormones out of balance. And when hormone levels shift, especially testosterone and estrogen, that directly impacts the prostate size and health. One study published in the Journal of Urology even found a correlation between high intake of ultra-processed food and increased risk of prostate disease. That's not to say one spicy burrito will ruin you, but if that's your dinner 3 times a week, your prostate might be paying the price. So what should you eat instead? fresh fruits, vegetables, lean proteins, omega-3 rich foods like salmon. Simple, natural, and anti-inflammatory. I always say, your prostate is like a picky neighbor. Feed it right, and it'll stay quiet. But irritate it too often, and it'll wake you up all night long. Let's keep going. The next habit is one I see all the time, and it's totally avoidable. This one's a classic. You're out shopping. You're on the phone. You're stuck in traffic. And you tell yourself, I'll hold it. Sometimes for 10 minutes. Sometimes for hours. But holding in your pee too often isn't just uncomfortable, it's damaging to your bladder and your prostate. See, when you hold it in, your bladder stretches beyond its comfort zone. That puts more pressure on your prostate, especially if it's already a little enlarged. Think of it like inflating a balloon inside a small box. It starts pushing on everything around it. Over time, this constant stretching can weaken your bladder muscles and irritate the tissue around your prostate. And if urine stays in the bladder too long, it becomes a breeding ground for bacteria. That means a higher risk of urinary tract infections, which can lead to, you guessed it, inflammation of the prostate. One man I worked with, early 70s, retired contractor, used to avoid public restrooms at all costs. Said he'd rather hold it than use those dirty stalls. But eventually, he developed a serious infection and ended up needing antibiotics and weeks of recovery. All because he didn't listen to his body. So here's my advice: when your body says go, go. Don't wait. Don't push through it. Your prostate will thank you. And in the next section, we're going to talk about one of the biggest enemies of your prostate, and it's everywhere. You breathe it in more often than you think. I know this one can be tough to talk about. But if you smoke, or if someone around you smokes, you need to hear this. Tobacco smoke is one of the most silent and sneaky enemies of your prostate. It doesn't matter if it's a cigarette, a cigar, or secondhand smoke from someone else. What matters is what's in that smoke, thousands of chemicals, many of which damage your blood vessels. And when blood flow drops, your body can't heal, protect, or regulate itself like it should. Now, let me be clear, your prostate depends on healthy blood circulation to stay nourished and balanced. But smoking narrows those vessels, chokes off the oxygen supply, and triggers inflammation. That inflammation doesn't just affect your lungs or heart, it makes its way down to your pelvis, straight to your prostate. Even worse, long-term smoking has been linked to a higher risk of prostate cancer. The American Cancer Society has highlighted several studies showing that men who smoke are more likely to die from prostate cancer than non-smokers. That's not scare talk, that's real science, and it's backed by years of research. One of my patients, a former truck driver named Joe, finally quit smoking in his 60s after noticing worsening prostate symptoms, constant night urination, burning, even pelvic pain. Within months of quitting, his symptoms improved dramatically. Not instantly, but enough that he could sleep through the night again. So if you've been thinking about quitting, let this be your reason. And if you don't smoke, don't let yourself breathe in someone else's habit. Your lungs and your prostate deserve clean air. Let's move on to something just as dangerous, but even easier to overlook. Listen, I get it. Doctor visits aren't exactly anyone's idea of fun. But skipping your yearly checkups? That's a risk you don't want to take, especially when it comes to your prostate. The truth is, prostate problems often start silently. No pain. No warning signs. Nothing that makes you stop and think something's wrong. But behind the scenes, the prostate could be swelling, changing shape, or developing growths you can't see or feel. That's why prostate-specific antigen, PSA, tests, digital rectal exams, and routine health checks are so important. They help catch issues early, before they turn into serious, life-altering problems like prostate cancer or complete urinary blockage. I've had patients come in for unrelated issues, like back pain or fatigue, and we discovered their PSA levels were dangerously high. Early detection gave us time. Time to treat, manage, and in many cases, avoid surgery or complications entirely. Skipping these exams isn't just risky, it's unnecessary. They're quick, simple, and they can literally save your life. So here's my advice. Put your annual checkup on your calendar. Don't cancel. Don't delay. Think of it like changing the oil in your car. It might seem small, but it keeps the whole engine running smooth. Now let's talk food again, and this one might surprise you. Now I'm not saying you can't enjoy a good steak. But if your diet is heavy on red meat, especially processed meats like bacon, sausages, and deli cuts, you might be setting yourself up for serious prostate trouble. Why? Because red meat, when eaten frequently, has been linked to higher levels of inflammation and hormonal imbalance, two of the biggest factors in prostate enlargement. Your body needs a delicate balance of hormones, especially testosterone and estrogen, to keep your prostate healthy. But high saturated fat and certain cooking methods, like grilling or frying at high temperatures, create compounds that disrupt that balance and promote the growth of abnormal cells. The World Health Organization even classifies processed meats as a Group 1 carcinogen, meaning there's strong evidence linking them to cancer, including prostate cancer. One of my patients, Alan, loved his burgers and brats. But after struggling with frequent urination and pelvic discomfort, he agreed to cut back. We swapped in more fish, chicken, legumes, and plant-based meals. Within 2 months, he was sleeping better, moving easier, and even lost 10 pounds without feeling deprived. So you don't have to give up red meat completely, but try to make it the exception, not the rule. Your prostate will reward you with less swelling, better hormone regulation, and a lower risk of long-term issues. Speaking of swelling, there's one thing that makes inflammation worse than almost anything else. That stubborn belly fat? It's more than just extra weight. It's actually biologically active, meaning it produces chemicals that trigger inflammation throughout your body, including your prostate. Visceral fat, the kind that wraps around your organs and sits deep in your belly, releases substances called cytokines. These messengers tell your immune system to stay in a constant low-level alert mode. The result? Chronic inflammation, hormone disruption, and pressure on your pelvic organs. Multiple studies, including those cited by the Mayo Clinic, show that men with larger waistlines have a significantly higher risk of developing benign prostatic hyperplasia, BPH. That's the medical term for an enlarged prostate. One man I treated, 68 years old, had battled prostate symptoms for years. But once we started focusing on his waistline, daily walks, smaller meals, less sugar, he lost 15 pounds in 3 months. His symptoms eased up, his sleep improved, and his confidence came back. He didn't have to be perfect, he just had to be consistent. So if your pants are feeling snug around the waist, it's not just a fashion issue, it could be a health warning sign. Let's finish strong with one of the most overlooked causes of prostate trouble. Stress isn't just a feeling, it's a physical force. And when you're under stress for too long, your body releases a hormone called cortisol. In small doses, cortisol helps you respond to challenges. But when it stays high for weeks or months, it can disrupt your entire system, including your prostate. High cortisol leads to inflammation. It messes with your testosterone levels. It tightens the muscles in your pelvic area. And worst of all, it keeps your nervous system in fight or flight mode, which makes urination even harder and more frustrating. I had a patient once, a recently retired accountant. He wasn't eating poorly, he exercised regularly, but he was constantly worried about his finances. The anxiety was through the roof. When we added relaxation techniques like breathing exercises, light yoga, and a bit of therapy, his prostate symptoms improved more than with any medication. Managing stress doesn't have to mean meditating for an hour a day. It could be a walk in nature, listening to music, calling a friend, or even just 5 minutes of deep breathing. Whatever works for you, do it regularly. Your prostate and your peace of mind depend on it. So there you have it. 10 habits that might seem small on their own, but together they can quietly chip away at one of the most vital parts of a man's health, the prostate. And here's the truth no one likes to say out loud. You don't wake up one day with prostate problems out of nowhere. They build up slowly, silently, day by day. Skipping breakfast, not drinking enough water, sitting too long, living under constant stress, smoking that just one cigarette, all of it adds up. But here's the good news, your body is always ready to fight for you. It's waiting for you to meet it halfway. You don't need a total life overhaul. You don't need to move to a farm or give up everything you love. But you do need to make small, conscious choices every single day. Stretch your legs. Choose whole foods. Breathe deeper. Get checked. Talk to your doctor. And most importantly, don't ignore the signals your body is sending you. Your prostate doesn't have to control your life. You can stay sharp, strong, and in control if you take care of it now. And if this video gave you even one idea, one habit to change, or one reason to finally prioritize your health, then do me a favor. Give it a thumbs up, share it with a friend who might need it, and subscribe for more doctor-backed tips designed for your stage of life. Because here on this channel, we don't just talk about health, we help you live it. Until next time, take care of yourself. Your body will thank you for it.